House Bill 3800. Imagine this. Imagine a group of rural nurses, long-term care workers, and small-town hospital staff struggling to fill jobs and keep their communities healthy. They want a seat at the table to help shape how Texas tackles the healthcare staffing crisis. But when the meeting starts, they realize they were never invited. What the bill says it does? It creates an advisory board to develop a guide that helps local healthcare groups and educators work together to fix workforce shortages. What it actually does? This means the executive director of the Texas Workforce Commission can now handpick every board member, while everyday providers, educators, and smaller communities lose the ability to participate or to be heard. Who benefits? Large hospital systems, statewide health associations, workforce boards with lobby connections, and university-linked training programs. Now, who pays the price? Rural health providers, long-term health care and hospice organizations, public education agencies like the TEA, Texans in underserved areas with persistent staff shortages. Why this matters. If only a few insiders define the healthcare crisis, only their version of the solution gets funded. That leaves local providers, who know their communities best, without support, while the same institutions with lobbyists at the Capitol decide where the future resources go. Questions to ask your lawmakers. Why remove rural long-term care and education voices from a board tasked with solving statewide problem? Shouldn't the public have access to who gets appointed and what decisions are being made? And would you support making the advisory board's meetings public and requiring legislative review of its recommendations? Bottom line, House Bill 3800 gives political appointees quiet control over who defines Texas healthcare workforce crisis and locks the public out of the solution.